According to the CDC, drug overdoses account for 1 million emergency room visits per year. Saline County's opioid-related fatalities are among the highest in the state of Kansas. My name is Zara Nasra Azadani, Emergency Medicine Clinical Pharmacist at Salina Regional Health Center.
Zara, thank you so much for being on the show. We're going to be talking about opioids. So as a pharmacist, why don't you give us a little information about opioids?
Well, thanks for having me. Opioids are a class of medications that provide powerful pain relief.
Okay.
Some people refer to them as narcotics, but medically the word opioid has a really specific meaning. And so all opioids in one form or another are derived originally from opium, which is where they get their name, and they're all at least structurally related to morphine. So they have a lot of things in common, but one of the most important things is that they're very powerful pain medications used to manage specific kinds of pain.
Now the downside, they are quite addictive. Why don't you talk about that?
So opioids are addictive in part because of their widespread availability. They are available as prescriptions, but also in illicit forms as well. The other reason that they can be very addictive is because of the impact that they have on the brain. So they make people feel really good sometimes, and that is a compelling reason that people sometimes seek them out.
Let's talk about some of the things the hospital and pharmacists in the area are doing to combat opioid addictions and opioid problems.
So one measure that we can take is ensuring that when opioids are prescribed, that they are for limited amounts of time and for appropriate reasons. We can also maximize other interventions like ensuring that people get enough Tylenol and other mechanisms of action to make sure that the pain is being addressed from every angle. Another important intervention is something called harm reduction, and for the most part that is going to be making sure that Narcan or naloxone is available to every at-risk patient who needs it. And that is a medication that helps reverse the effects of opioids. One safety measure that we can take is ensuring that prescriptions at home that we no longer need are safely disposed of. And so sometimes even well-meaning, we don't necessarily store these in the safest way. So once you're done with a medication, the best thing to do is dispose of it safely. You can do that at home by mixing old prescriptions that you want to dispose of with something foul like cat litter or coffee grounds and throwing it away without any identifying information on the bottle. But another way that you can do that is by utilizing drug take-back events or the new medication disposal cabinet at Salina Regional's outpatient pharmacy. Any time that the pharmacy is open, you can go in and drop medications in that cabinet and keep them safely out of the home.
Thank you so much for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter and Instagram.